How to make your penis bigger and thicker? Is it even possible? It's a question that's on the minds of so many men, maybe more than you'd think. And today, we're going to tackle it head-on with complete honesty and the clarity you deserve. If you've ever felt a bit of anxiety about this or gone down a rabbit hole of online articles and forums, you are far from alone. The internet is flooded with conflicting advice, miracle cures, and frankly, some really dangerous information. It's a space that can often prey on insecurity, making it incredibly confusing to know what's real and what's just an empty promise. My goal in this video is to cut through all that noise and provide you with responsible, clear, and evidence-based information so you can understand the full picture. So, I want to tell you right from the start, the answer to that big question isn't a simple yes or no. It's much more nuanced than that. But understanding this topic with accuracy and care is absolutely critical before you even think about trying anything. This isn't just about anatomy, it's about psychology, safety, and what it truly means to be confident. Over the next few minutes, we're going to break it all down. We'll start by looking at what science actually says is normal, and the results might surprise you. Then we'll dive into the powerful psychological component behind this concern. Something that's often overlooked but is arguably the most important piece of the puzzle. We'll carefully examine the non-surgical methods you've heard about, from pumps to extenders to fillers, separating fact from fiction. We'll even touch on the surgical options and their realities. This video is about giving you the information you need to make safe, informed decisions for yourself and to help you find a path to genuine self-assurance, which might have less to do with physical size than you've been led to believe. So, before we even begin to talk about methods of enhancement, we have to establish a realistic baseline. What is actually considered a normal penis size according to science? The answer might be very different from what you think. One of the most comprehensive studies on this topic involved nearly 50,000 heterosexual men and their partners. The findings were revealing. First, it showed that about 55% of the men were unhappy or insecure about their penis size. That's more than half. If you've ever felt this way, that statistic alone shows you are not the only one. It's a widespread concern. But here's the most critical part of that study. When their female partners were surveyed, a staggering 85% reported that they were perfectly satisfied with their partner's penis size. Let that sink in for a moment. While more than half of men were worried, the overwhelming majority of their partners had no issue at all. So, what explains this massive gap between how men perceive themselves and how their partners see them? A huge part of it comes down to perception, which is heavily shaped by our culture, and perhaps most significantly by the world of pornography. Pornography has created a completely unrealistic and distorted standard of what is normal or desirable. The performers in adult films are often specifically chosen because they are anatomical outliers. They represent the extreme end of the spectrum, not the average. It's like watching professional basketball players and believing the average height for a man is 6 feet 7 inches. It's a curated reality designed for entertainment, and it has set a benchmark that is statistically impossible for most men to meet. This constant exposure can lead to a deep-seated feeling of inadequacy, even when there is absolutely no basis for it in the real world. So let's look at the real-world numbers. Based on multiple scientific reviews, the average length of an erect penis is around 13.2 centimeters, which is about 5.2 inches. Medically, a penis is only considered clinically small, a condition known as micropenis, if it measures less than 7.5 centimeters or about 3 inches when erect. It's vital to understand that this condition is extremely rare. The vast majority of men fall comfortably within the normal range. So the first and most crucial step on this journey is recognizing that the ideal you might be comparing yourself to is likely a manufactured one, a fantasy that doesn't reflect reality or, more importantly, what your partner actually values. The anxiety so many men carry is often built on a foundation of misinformation, not anatomical fact. So if the science clearly shows that the vast majority of men are well within the normal range and that their partners are overwhelmingly satisfied, why does this anxiety persist so strongly? This is where we move from a conversation about anatomy to a much more important one about psychology. This intense, persistent, and often distressing worry about penis size has a name. It's commonly referred to as small penis anxiety. But it's more than just a simple worry. For many, it's a manifestation of a recognized psychological condition called body dysmorphic disorder, or BDD. Body dysmorphic disorder is a mental health condition where a person becomes obsessed with a perceived flaw in their appearance, a flaw that is often minor or completely unnoticeable to others. Small penis anxiety is considered a specific form of BD, where the obsessive focus is on the size of the genitals. This isn't just about vanity or wanting to look a certain way. It's a powerful and often painful obsession that can completely take over a person's thoughts and dictate their actions. The impact of this condition can be devastating and can seep into every corner of a person's life. It can lead to avoiding intimacy and relationships altogether out of fear of judgment or embarrassment. It can self-esteem, making it difficult to feel confident in social situations or even at work. The constant mental energy spent worrying and comparing can be exhausting, and in the most severe cases, it can be a contributing factor to serious depression and even suicidal thoughts. This is a serious mental health issue, and it needs to be treated with compassion, understanding, and professional care. And this is why the first and most important step in addressing this issue isn't about trying to change your body. It's about treating your mind before considering any physical procedure. The most effective and proven treatment for small penis anxiety is psychological counseling or therapy. Working with a therapist can help you unpack the root causes of these feelings, challenge the distorted negative thought patterns you've developed, and build a healthier, more realistic body image. In fact, a remarkable thing happens for many men who begin therapy to deal with this specific anxiety. They eventually decide against pursuing any physical procedures at all. Why? Because they come to realize that the problem was never truly about inches or centime. It was about perception. Through therapy, they learn to dismantle the unrealistic standards they've held themselves to, rebuild their self-worth from the inside out, and understand that their value as a person and as a partner is not defined by a tape measure. Okay, so we've established that the psychological aspect is the most important part of this, but I know you're still curious about the physical methods you see advertised everywhere online. Do any of them actually work? And more importantly, are they safe? Let's put them under the microscope. First up is one of the most common non-surgical methods, penile extenders, also known as traction devices. The idea behind these is pretty straightforward. A penile extender is a mechanical device that you wear on your penis when it's flaxed. It has a base ring, 2 rods along the side, and a support at the end that holds the head of the penis. The device applies a gentle, continuous stretching force, a principle known as traction. The theory is that this sustained tension will stimulate the cells in the penile tissue to divide and multiply over time, leading to a gradual increase in length. So, does it work? Some studies have shown that with consistent use, extenders can result in a modest increase in length, typically up to about 2 centimeters or a little under an inch. But consistent use is the key phrase here. We're talking about wearing the device for several hours every single day for many months on end. This isn't a quick fix. It's a significant time commitment that requires a huge amount of discipline. This comes with its own set of challenges. It can be uncomfortable, inconvenient, and for many men, it's simply not practical to incorporate into their daily lives. There are also potential side effects such as temporary numbness, bruising, skin irritation, and even pain if not used correctly. For many, the slow, minimal results can lead to frustration, and they give up long before seeing any change. Next up are vacuum pumps. You've probably seen these advertised as well. A vacuum pump consists of a plastic cylinder that you place over your penis, a pump to create a vacuum, and a constriction ring for the base. Let's be very clear about their primary medical purpose. They are designed to help men with erectile dysfunction achieve an erection right before sex. They are not designed for permanent enlargement. The vacuum draws blood into the penis, causing it to become engorged and erect. This can make the penis temporarily look and feel larger due to the swelling. However, this effect is entirely temporary. Once the blood flows back out, the penis returns to its normal size. There is no scientific evidence to support that using a vacuum pump leads to any permanent increase in length or girth. This brings us to one of the most popular and by far one of the most dangerous areas of non-surgical enhancement: injectable fillers. And this is where I need you to listen very, very carefully. The goal with fillers is typically to increase girth or thickness. Let me be extremely clear on this. The only type of filler that has some level of medical acceptance for increasing penile girth is hyaluronic acid. This is the same type of substance used for facial fillers. It's a gel-like substance that your body can naturally dissolve over time, but you will see people online or in unregulated clinics offering injections of other substances like PMA, a type of permanent plastic bead, industrial-grade silicone, or various oils. Do not do this ever. Injecting these unapproved permanent substances can lead to catastrophic and irreversible consequences. We're talking about severe deformities, chronic and debilitating pain, hard lumps called granulomas that can only be removed surgically, infections that can lead to tissue death or necrosis, and permanent disfigurement. The damage from these injections can be so severe that it can destroy sexual function and require multiple complex reconstructive surgeries. And even then, a normal appearance and function may never be restored. The risks are absolutely life-altering. Even with hyaluronic acid, which is considered safer, the procedure is not without its own risks like lumpiness, unevenness, or infection. It must be performed by a highly specialized urologist or plastic surgeon with extensive experience in this specific and delicate procedure. The results are also temporary, typically lasting for about a year before the body absorbs it, requiring repeated treatments to maintain the effect. It remains a controversial topic even among medical professionals. So, as we've seen, many of the common non-surgical methods are disappointing at best and downright dangerous at worst. It can feel like you're running out of options. But what if the real issue isn't about stretching or temporary swelling? What if it's about targeting the hidden root causes inside your body that even doctors often overlook, like a specific boner killer enzyme that sabotages your erections? I recently came across a fascinating presentation by a man who went through this exact struggle himself and nearly lost everything. In his journey, he discovered a bizarrely simple all-natural home remedy he calls a purple hardening tonic. It's a completely different approach that focuses on restoring your body's own powerful erection-boosting process from the inside out. His story is incredibly compelling. If you want to hear it and learn about this unique method, you can watch the full free presentation right now. Just open the camera on your phone and point it at the QR code you see on your screen. I've also pinned a link for you at the very top of the comment section below. Now, for those who might still be considering the most extreme options, we need to have a serious talk about the realities of surgery. Now let's move on to the most invasive and high-stakes option of all, surgery. When other methods fail to deliver, or when the desire for a change is overwhelming, some men consider going under the knife. But is it worth the risk? It's crucial to understand from the outset that the vast majority of major medical and urological associations around the world do not recommend or endorse surgery for purely cosmetic penis enlargement. These procedures are typically reserved for reconstructive purposes. For instance, in cases of congenital abnormalities, traumatic injury, or after cancer treatment. When performed for cosmetic reasons, they are considered highly controversial, experimental, and carry significant risks that often outweigh any potential benefits. The most commonly performed procedure for increasing length is called suspensory ligament release. The suspensory ligament is a tough fibrous band of tissue that attaches the base of the penis to the pubic bone. It essentially holds the penis up and provides support. During this surgery, a surgeon makes an incision at the base of the penis and cuts this ligament. The idea is that by severing this anchor, a portion of the penile shaft that is normally inside the body will be able to slide forward and hang lower, creating the appearance of a longer flexed penis. But here is the critical point that is often misunderstood. This surgery does not increase the actual length of your penis when it is erect. The gain in length is only visible when the penis is flaxed. When you have an erection, the functional length remains exactly the same as it was before. For this purely cosmetic change in the flaccid state, there's a significant trade-off. The suspensory ligament provides stability to the erection after it's cut. Many men report that their erection is less stable or points downward at an awkward angle, which can sometimes interfere with intercourse. For many, this is a source of great dissatisfaction. What about increasing girth? There are also surgical procedures for this, which are even more complex and risky. These can involve grafting tissue like fat, skin, or veins from another part of your body and wrapping it around the penile shaft. There are also methods that involve inserting silicone sheets or other materials under the skin. These procedures have a very high rate of complications. The risks include severe infection, scarring that can cause the penis to curve or shorten, the exact opposite of the desired effect, the formation of hard, unnatural feeling lumps, and a significant loss of sensation. Patient satisfaction rates for these surgeries are notoriously low. Often the end result can look and feel artificial, which can lead to even greater psychological distress than the original concern. Because of these high risks, unpredictable results, and the potential for permanent negative consequences, these surgeries should only ever be considered within the context of a formal ethics-approved clinical trial where all the risks are fully disclosed and the patient is closely monitored. For the average man who is anatomically normal but feels insecure, surgery is almost never the right answer. So, after exploring all of this information, where does that leave us? The truth is, when it comes to safely and effectively changing the size of your penis, the options are extremely limited, and most of what is marketed to you is either ineffective, dangerous, or both. The safest, most reliable path to feeling better about yourself doesn't start with a device, a needle, or a scalpel. It starts with your mind. Therapy is without a doubt the most powerful and effective tool for overcoming the anxiety and insecurity that drives this concern. For those who are still determined to explore a physical change, the only methods with some degree of scientific support and relative safety are penile traction devices used under medical supervision or hyaluronic acid fillers for girth performed by a top-tier specialist. And even these come with significant caveats, risks, and often underwhelming results. Here is the most important message I want you to take away from this video. Your value as a man, as a partner, and as a human being is not and will never be measured in sentiment or inches. True confidence isn't something you can buy or surgically attach. It comes from self-acceptance, from the respect you have for your own body, and from the connection you build with your partner. Sexual pleasure is an experience built on intimacy, communication, security, and mutual respect, not on a physical measurement. Your worth is inherent. If this video has helped you gain some clarity, or if you think it could help someone else, please share it. Let's work together to replace harmful myths with responsible information. And I'd love to hear your thoughts, so leave a comment below. Have you ever felt confused by the information out there? Sharing your experience can help others feel less alone. Finally, if you appreciate this kind of honest, non-nonsense approach to health and wellness, be sure to subscribe to the channel and turn on notifications so you don't miss out on future content. Thank you so much for watching. Be kind to yourself. Take care of yourself.